The seasonal flu happens and comes and it goes, and it can be very bad, but people don't talk about it in the same way, and they shouldn't. We're also using the full power of the federal government to defeat, as you know, the China virus. New cases have declined in 80% of the jurisdictions in the past week. 80%. New Zealand, by the way, had a big outbreak. And other countries that were held up to try and make us look not as good as we should look, because we've done an incredible job, but they're having a lot of outbreaks, but they'll be able to put them out, and we put them out. The hospitalization rate has fallen in our country, 54% since its peak in April, 54%. Older Americans are still the most vulnerable to the virus. 92% of deaths have occurred among those 55 and older. Only 2.7% of deaths have occurred among those 44 years. Think of that, 44 years and younger. So 44 years old and younger, only 2.7% of deaths have occurred. And many of those people had pre-existing conditions, they had problems, heart, diabetes, and other problems, but many of those. So think of that, only 2.7% under 44 years of age. Excess mortality in Europe this year is 33% higher than the United States. Evidence that the tragic cost of this virus is higher in other Western nations. South Korea, you've been reading about South Korea doing well. Well, they just had a very big breakout, but they'll be able to solve the problem. We must all remain vigilant and continue to exercise extreme caution around those at highest risk. As we know, multiple colleges and universities announced that they would suspend in-person teaching. Now, we have learned one thing. There's nothing like campus. There's nothing like being with the teacher as opposed to being on a computer board. It's been proven a lot better. It's a lot better. The iPads are wonderful, but you're not going to learn the same way you do by being there. So, nevertheless, certain colleges and universities have announced that they would suspend the in-person teaching. For older people and individuals with underlying conditions, the China virus is very dangerous, but for university students, the likelihood of severe illness is less than or equal to the risk of a seasonal flu. And the seasonal flu happens and comes and it goes, and it can be very bad, but people don't talk about it in the same way, and they shouldn't. But if you look at that, the odds are less than or equal to. Instead of saving lives, the decision to close universities could cost lives. It is significantly safer for students to live with other young people than to go home and spread the virus to older Americans. Makes sense? And the shutdown thing is causing tremendous depression for those places that are still shut down. You look at certain areas that, in all cases, Democrat-run, still shut down, and their numbers there aren't even good, but causing tremendous depression, suicide, drugs, alcohol, abuse. A lot of problems are being caused. Probably far more, I would say, Scott, than is caused by the virus itself, now that we understand the virus. Colleges should take reasonable precautions. Students who feel sick should not attend class and should limit social interaction as they would for any other illness. And universities should implement measures to protect the high-risk students or professors and teachers. The ultimate goal of testing is to prevent transmission in high-risk settings and to prevent transmission, period, but especially in nursing homes, and to care for the vulnerable and our elderly, which really fit into that definition of who is vulnerable. We have tremendous unused testing capacity in our country. We have a tremendous unused testing capacity. It's something that a lot of other nations are very impressed with, they tell us. In our path forward, we will continue to follow a science-based approach to protecting the high risk while enabling healthy Americans to safely go back to work and school. Our country will be open. Our country is getting open quickly. Our stock markets are almost back to where they were prior to the China virus disaster coming in. And I want to thank you all for being here, and we'll take some questions. Yeah, please.